Physique assessment. The question our expert panel addresses is: how often should body composition be assessed? Associate Professor Gary Slater.
The frequency of body composition assessment really depends on two things for mine: the specific client and the goal they're trying to achieve, as well as the technique you're using for being able to assess physique traits. Now, if a client isn't looking at trying to change their body composition, we would assess their body composition much less regularly. But if they're actively trying to change their body composition, then it becomes something that's undertaken more frequently. Why? Because it provides invaluable feedback for the client or the athlete, as well as the practitioner, to be able to further personalise the interventions that are being applied to ensure that you're optimising adaptations. Now, the second component of that, what technique do I use? Well, how that impacts. It really impacts by the noise or the potential error associated with the technique. If you have a technique that has very little error associated with it, you're afforded the opportunity to be able to assess more regularly, because its ability to pick up small changes is very good. If you have a technique that is influenced heavily by technical aspects or client presentation biological factors, then you simply can't assess them that often, because the noise associated with the measure may be greater than the real change you're picking up over time. And that's why, for me, if I'm dealing with clients that are trying to change their body composition quite aggressively, we think about an athlete in a weight category sport or an aesthetic sport, a bodybuilding athlete for example, we might assess their body composition as frequently as every 2 to 3 weeks. Now, when I'm doing that, I'm really only afforded the opportunity to use one technique, and that's surface anthropometry. Why? Because it's so reliable in the hands of a highly skilled technician. Techniques such as DEXA, for example, there's restrictions on how many times you can DEXA scan a client per year because of the radiation exposure. Yes, it's a very small radiation exposure, but it still does add up and contributes to their total exposure over a period of time.
Dr. Kagan Ducker.
I think it comes down to how often you expect to see a change. There's certainly something to be said for monitoring over a length of time so that you have a relatively normal baseline for a person or for an athlete. But definitely the main reason to assess is at times when you know you're going to be causing a change, whether that's from their training or modifying their diet, or from experiencing different conditions. So things like altitude, you might want to try and assess changes that might occur.
Professor Tim Ackland.
While there's a desire to measure body composition on a regular basis, we need to understand the error of this measurement. There is absolutely no point in trying to measure changes in composition that are smaller than the error of measurement. So we would recommend for skin folds or DEXA that you measure on no more than 3 or 4 occasions per year. But with something like ultrasound, which is more precise, you could measure your participants monthly.
Associate Professor Masaharu Kagawa.
In order to depict changes in body composition, this is depending on the population who you are looking for, but usually take another measurements after 3 months in order to find out if there is a definite changes in skin folds or muscle mass increase.
For further information on physique assessment, see our book, Best Practice Protocols for Physique Assessment in Sport, published by Springer.